Hey, so welcome everyone, and we do look forward to a very informative session today. We here every month end on the APA platform, the Adventist Health Professionals Association platform, and today Trinidad is hosting. We do share the platform with the Tobago chapter. For those of you who are new, we do welcome you, and please keep tuned in for invitations that comes about every month's end. Today, we have quite an interesting topic, and we're looking at diabetes. And we have none other who's specialized and versed in this area, an expert in the field, none other than Mr. Desmond Crocker. Now, just to give you a little background on him, he holds a master's in advanced nursing, and he is all the way out in Jamaica at Jamaica University of Technology as a lecturer there. And he also is specialized in diabetes, self-management education, and support. He hosts several programs over time, both in his local, regional, and international spheres. Mr. Crocker, he's been doing this for quite a number of years. I think I've known him for a little over a decade. Yep, and he has a special interest, love for diabetes education. So he has lots of answers and experience, and we do invite you to take notes, to come up with your questions. You can put your questions in the chat as we continue to speak. However, you can also look forward to the end of the presentation when we will have our Q&A segment. Mr. Crocker, if there's anything else that you think I may have missed that our audience need to know and hear about you, then please feel free to fill that gap. Not only is he versed in managing diabetes, but also high blood pressure. You know, those sister non-communicable diseases. He's also the CEO of Annie's Memorial Chronic Diseases Education Center. And so we do look forward to hearing much from him. And the floor is now open to you, Mr. Crocker, to speak to our audience.
Hello, everyone. Hello. It is a great pleasure to be here. Thank you, Dr. Nash, for those kind words of introduction. And what you've said is enough about me. All right. Today we are going to look at diabetes from a perspective that is not usually seen, right? From a different perspective to what is usually seen. And but a very important perspective as though. And so you know, in my dealing with persons who have diabetes, I realize that this is a crucial gap in the healthcare delivery that is missing and might be very essential in helping to curb the spiral trends that is going on with diabetes and complications associated with diabetes. All right, so I am going to start sharing my screen now. Okay, there we go. All right. So we are looking at the mind-body connection. What is the relationship between the mind and the body in relation to diabetes, right? The diabetes and mental health uncovered. So today we're going to cover the connection between diabetes and mental health, and explore what is this connection and its impact on the mental well-being of persons with diabetes. We're going to look at a holistic approach to the care of persons with diabetes, emphasizing the importance of integrating mental health support into diabetes management. And I'm sure if I ask, or if I create a poll and ask how many persons, when they go to the clinic for when they go to diabetes clinic, how many persons are assessed for mental health, um, I will get nobody uh responding, because I have been in the system and I know what obtains out there. And it's um not only in Trinidad, um, other places in the Caribbean and possibly even the world, um, the assessing for mental health, um, might actually, I can recall when before I did my diabetes training, my mother was diagnosed with diabetes, and I remember at one time the doctor referred her to psychiatric clinic, and I was so, you know, I don't know if I would say upset or confused. Why would this doctor refer my mother to the psychiatric clinic? And it's only, and by the way, I was already a registered nurse at that time. All right. And it's only long after, long after completing my diabetes education certification, that I really got to make that connection between the two. All right. And we're going to also talk about empowering individuals, and highlighting strategies to help persons with diabetes to achieve better overall well-being, because that's the end goal. All right. We don't only want people to be um, physically well, which really and truly they cannot be physically well if they're not mentally and emotionally well. And so we want to have this holistic um, approach to the management. So, a bit on diabetes. Diabetes is a long-term health problem that happens when your body is having trouble using the sugar to make energy. All right. Um, our bodies need a hormone called insulin, and this insulin is what helps to move sugar from in your blood when you eat the carbohydrates in the food turns to sugar and gets into your blood. That sugar from the blood needs to move in cells. For that to happen, insulin must be produced by the pancreas, and that is what will um, take sugar into the cell. And it's in the cells that the cells will now take that sugar to make energy. All right. With diabetes, however, either there's not enough insulin being produced or the insulin is not working properly. All right. Because of that, sugar remains in the blood until it is able to go into the cells. All right. um, the problem though is the longer the sugar remains in the blood, it causes problem. It becomes like sandpaper on the walls of your blood vessels and starts to destroy it. All right. And if you really take a notice, blood flows anywhere in the body. So this sandpaper is traveling all over the body and causing problems all over in your heart, in your eyes, your nerves, your kidneys, all over. All right. And that is not a good thing. It causes a whole lot of problems for the persons with diabetes. And the thing is, it don't have to. All right. With with proper management, we can be able to handle these things. So we're talking about diabetes and mental health. Now, these are the what I would call, the areas of mental health that are that become um part of the problem with managing diabetes. First, there's depression. All right, it don't have to happen in this order, but we just identifying them. All right, depression, where individuals with diabetes, persons with diabetes are at higher risk for developing depression. And what we're talking about is where the person with diabetes feels so despondent and hopeless about their care, right? And this can significantly impact their their own ability to manage their condition. So you're gonna tell them to get up and exercise 5 days a week. But a person that is in depression will not have that motivation to get up and exercise. A person with depression will not have that will to do anything for the even if it means for their own health. All right. So depression is one. Anxiety is another one. All right. The constant worry and fear of complications because they might have a mother or grandmother who had diabetes and they had a foot cut off. They had to be on dialysis. They go blind. And so the person living with diabetes is in constant fear of them having to deal with that themselves. All right. Those complications. All right. And that can affect their management. All right. Then there's emotional distress. There's two types of distress. There's emotional distress and there's diabetes distress. Emotional distress speaks to the burden of living with a chronic disease. Now, living with a chronic disease is not easy. All right, you got to be you know, it can lead to frustration, overwhelm, all right, because they have to be remembering so many things, and people telling them this and telling them that, and everything that they do, somebody is going to say something to them about it, especially when it comes to eating and things like that, and so that can cause emotional distress. And the thing is, there's so much disinformation out there in relation to diabetes management, right? And so it can cause an emotional distress. And then there's diabetes distress. This is distress that is specifically related to diabetes management. All right, the daily demands of managing diabetes. You have to take your medication. You have to eat a certain amount, all right, and no more. You got to watch how your carbs going. You got to make sure that you're exercising. There's so many aspects to diabetes that can, in and of itself, just the management of diabetes can lead to distress. And so these are the issues that persons with diabetes have to be dealing with. All right. What's happening? Oh. All right. So let's delve a little more into diabetes and mental health challenges. All right. Um, and well, the whole relationship between diabetes and mental health. We're going to start first with diabetes and mental health challenges. So there's a vicious cycle between diabetes and mental health. All right. Living with diabetes increases your risk for mental health. All right. And the thing is, a lot of times we don't, because it is not assessed, we don't really recognize the the relation. All right. Living with diabetes increases your risk. And this includes and the risk comes from the constant monitoring, dietary restrictions, fear of complications, stigma associated with diabetes. People tend to um, associate you with persons who um, didn't care for themselves well. All right. Um, Chronic stress are all associated with living with diabetes. Um, Stress that comes from all of that. When the body is stressed from all these things I've just mentioned, it releases two hormones, cortisol and adrenaline. Those two hormones raises the blood sugar. And so you'll find that a person would not eat, but the blood sugar is high. All right. It could be because of stress. All right. Um, Over time, stress can lead to depression, anxiety, or diabetes distress, as I described before. All right. Um, Depression, anxiety makes diabetes harder to manage. All right. As I was mentioning before, when somebody is depressed, their ability to be motivated to eat well or to exercise is null. They don't have any motivation for that. Um, they would miss their medication. They would miss appointments, right? They would feel fatigue and want to withdraw from society. And guess what? When they eventually go to the hospital and the people at the hospital realize that um their blood sugar is not managed, guess what? Instead of assessing their mental status, they accuse them of being non-compliant. And that only worsens situation because they feel so frustrated, they feel hopeless, and makes things even worse for their management. Right? Um, they get anxious and that can lead to obsessive checking, right? Every minute they want to check the blood sugar to see what it is like. All right. They panic over complications, and all of this lead to fear-based decision making. Um, there is poor self-care as a result of that, because remember, we're saying that if they are depressed, they're not going to have that motivation to do what they need to do. So um, there's irregular eating, poor sleep, reduced medication adherence, um, this seesaw between the high blood sugar and low blood sugar, all of this occurs as a result of all the of this depressed state. And that would result in decline in physical, mental, and emotional health. So we just identified the mental health risk associated with diabetes. Now let's look at how mental health affects the physical health now. Physical factors. Um, the blood sugar will affect the brain chemistry. All right. The brain relies a lot on glucose for energy. And when there is not enough glucose, it leads to this fluctuation with high and low blood sugar, which would lead to fatigue, difficulty concentrating, brain fog, and irritability. Um, the low blood sugar would lead to shakiness, panic, confusion, and mood swings. All of these are symptoms, right, or mimic the symptoms of anxiety and depression. And these repeated episodes can contribute to worsening of mental health. All right. Um, Insulin resistance is when the insulin is trying to move sugar from the blood into the cells, but it is not, it is being resisted, right? It's not being allowed to do that. And that can lead to inflammation. Uh, and inflammation um, is increasingly linked to depression. All right. Um, and then as a result of that depression and insulin resistance, we have that hormone, the stress hormone loop that I just spoke of. The, the stress lead to increase in cortisol and adrenaline. The increase in cortisol and adrenaline leads to increased blood sugar. Increased blood sugar lead to more insulin resistance. All right, because when there's increased blood sugar, the pancreas will send out more insulin, but with the resistance, insulin is not able to move the sugar into the cells, and the increased insulin contributes to insulin resistance. All right, and so there's that cycle going on. Um, that can affect things like mood. It can affect the variability in the blood sugar, high and low blood sugar. And so one time it's high in the air, other time it's low, and you really can't understand what's going on with this blood sugar. It can also affect your cognitive and sleep regulation. You find that the person is having difficulty sleeping at nights. All right. That leads to psychological burden, constant monitoring and decision, because this blood sugar is always all over the place. And so they have to be checking it. They want to be checking it all the time because they're anxious. They want to see what is really going on. Then that would lead to depression and distress, and then their adherence would be affected. They stop taking the medication because they really don't understand what's happening. It's up and down, it's high every time they check it. All right. And so they're all the efforts that they were making to keep this blood sugar control starts to wear down. All right. But however, while they're doing that, they're still in fear, they're still in anxiety for constipation. Then there's stigma and misunderstanding, as I mentioned before. When they decide to stop taking the medication, instead of the health system doing the mental assessment, they would basically cuss them out and reprimand them for being non-compliant. And all of these things contribute to increase mental health risk. Um, so there is a need for diabetes management, to helping persons with diabetes not only to cope physically but also mentally uh, in the management of their condition. All right, and so there's this bi-directional relationship: the diabetes affecting mental health and mental health affecting diabetes. All right, and so it calls for an integrated approach. All right, um, when we have an integrated approach, right, looking at it from that entire perspective and not only looking at the blood sugar level, when we look at the holistic approach, it identifies um, key emotional health um, and its effect on the diabetes management. It identifies physical health and its effect on diabetes management. It speaks to emotional stability when we can look at it from a holistic perspective. And when we fragment the care, focusing on only one area, focusing only on the physical, what the blood sugar is saying, what the blood test is saying. When we focus only on that, we fail the patient in terms of management. All right. So what does holistic approach look like? It don't necessarily have to be in this order, but these are what needs to be part of diabetes management: screening and assessment. Um, there's routine tools can be used to assess for depression, like the PQ-9 questionnaire, the general anxiety disorder the questionnaire, the problems area in diabetes, or the diabetes distress syndrome, diabetes distress scale. These are tools that are tested and proven to be able to act to I don't want to say accurately, but effectively assess um, various areas of mental health in diabetes. And it is recommended that screening persons when they come to clinic, or which at whatever um, opportunity, on a regular basis, screening them on a um, continuously. Well, I don't even know if I want to use continuously, on a regular basis. All right. Um, for mental health related challenges will help to identify these areas so that it can be addressed and, and affect the patient's management in a positive way. Then we want to look at collaborative care teams. The other thing is we don't have in the health system enough collaboration. And even if what they have is referrals, all right, and I'm speaking from experiential perspective, what they have is referrals. So the doctor will refer the patient to the dietitian. Um, well, that's the only place they refer patients to. What you notice here, right? Well, they might refer them to the endocrinologist, right? But diabetes educators, that is a no-no. That is not done at all. right? Psychologists, social workers, all right? And this list is not exhausted here. We need to be able to collaborate, right? Um, as healthcare professionals in the care of persons with diabetes. And it's only as we collaborate. I spoke about referrals and I'm saying that that is not collaboration, right? Because when the patient is referred to the dietitian, um, that's it. There's no feedback from the dietitian. There's no follow-up from the doctor. The person is sent to the dietitian and that's it. There is no collaboration. Then there's psychoeducation and counseling, right? Cognitive behavior therapy needs to be part of the diabetes management. Motivational interviews, all right? Problem solving therapy to support behavior change, right? Because um, we tell persons with diabetes to stop eat this and to eat only that and to um, exercise. But these are people that have been doing what you tell them to stop doing all their lives. Making that change is not easy. As we say, habits die hard. And so it's one thing to tell people what to do. The other thing is to help them to do show them how to do it. All right. And so we're saying that the psychoeducation counseling must be a critical aspect of diabetes management if we're going to get anywhere. And then there's diabetes self-management education and support. All right. Where this is a program that I instituted in Trinidad while I was there at the Arima Lifestyle Clinic, where persons with diabetes can come and interact with each other. They learn about diabetes management. They share stories together and support each other in their journey towards better diabetes management. Again, research has shown that this approach, this community approach, goes a long way in helping persons to cope with the mental and physical challenges associated with diabetes. And then closely associated with DSMES is the community and peer support of mind-body interventions, right? Where peer groups reduce isolation and normalize shared struggles, right? There's mindfulness, stress management, movement therapy, and sleep hygiene integrated into the care plans. Now, when we establish diabetes management in that way, the research shows that there's improved glycemic control, improved blood sugar management, there's reduced risk of complications related to diabetes, there's enhanced quality of life for the persons with diabetes. I noticed that arrow gone way down at the end there. All right. Increased treatment adherence. The patient is now empowered to follow the plan that is set out for them. When we approach diabetes in that way. This is a case study, a comprehensive diabetes management program at a leading healthcare center where a 45-year-old patient named Emma was able to successfully navigate the mind-body challenges associated with type 2 diabetes. Through a collaborative approach that integrated mental health support and personalized lifestyle intervention, Emma experienced significant improvement in both our physical and emotional well-being as a result of those interventions. In terms of percentage for the of the of mental health challenges associated with persons who have diabetes, the research shows that about 27% of persons with diabetes have depression, right? 40% have anxiety, 45% diabetes-related distress, and 10% have eating disorders. All right. And so without dealing with without assessing these things, we can't be able to identify it and deal with it accordingly. So the call to action, all right, is to recognize the bidirectional relationship between diabetes and mental health. You need to understand that diabetes and mental health issues can exacerbate each other. Both of them, right? So I wanted to mention, I remember years ago working here in Jamaica, one of my um I would say managers, the head of the school, she had diabetes and she was not able to get along with most of the staff. And people refer to her as this, this ugly person, so bad. But when well, she is now passed and gone. I remember talking with one of my colleagues uh, after and saying to her that her behavior was because of her diabetes. And my colleague was like, oh, she's so wicked and this and that. But I'm just saying that to emphasize that the healthcare system is missing this crucial area of mental health and its effect on diabetes. And so there is this vicious cycle where the person with diabetes end up with mental health issues, and the mental health issues exacerbate the diabetes, and so the cycle continues. So we want to recognize the bidirectional relationship. We need to recognize the bidirectional relationship. And secondly, we need to empower individuals with diabetes to prioritize their well-being. All right, so encourage people living with diabetes to actively engage in their care, including addressing the emotional and psychological aspects. For people with diabetes, they wouldn't know that when they don't feel like taking the medication, that's a mental health challenge that they're having. But it's only as we as they are it's only as they are brought aware of it will they be able to identify it. All right. And once they can identify it, they will recognize it for what it is and deal with it. So we want to encourage them, empower them. Integrate mental health support into diabetes here. All right. I've been saying that right through this presentation, right? Emphasize the importance of incorporating mental health services such as counseling, group support into the comprehensive management of diabetes. And there might be persons on here with diabetes. These are things that you can talk with your healthcare provider about. I don't know what kind of response you're going to get, but these are things that are essential for your diabetes management. And lastly, I have here advocate for policy changes to support the mind-body connection. All right, so we're looking at the policy makers and as healthcare providers, as persons living with diabetes, we can lobby, advocate for the policymakers to implement policies and funding initiatives that promote the integration of mental health and diabetes care that will ensure holistic and accessible support for persons with diabetes. All right. So this presentation underscores the vital importance of recognizing and addressing the mind-body connection in diabetes management. By adopting a holistic approach that integrates mental health support, healthcare professionals can empower individuals with diabetes to achieve better overall well-being and improve their quality of life. Thank you. That's my presentation. I am now open for questions.
Thank you very much, Mr. Crocker, for that presentation. And one of the things, the points that I took note of there is that living with diabetes increases one's risk for these mental health challenges. And therefore, as we could seek to improve our diabetic status, then our risk decreases, therefore, the mental health challenges. Thank you so much for the reminders. And let's see, do we have any questions out in the chat? Or you can simply raise your hand and we will take your question in. Any takeaways? What about takeaways for anyone? What resonated with you?
What is it? I'm not hearing properly.
Not hearing
And
me. Oh, no. Okay, so there we got a question for you. Can diabetes be reversed?
oh
What does that
yes,
mean?
it
Can
can.
diabetes be
Yes,
reversed?
yes, diabetes can be reversed. The American Diabetes Association define diabetes reversal or remission as a person being able to manage diabetes without medication, basically. All right. So you just manage with lifestyle. Once you and you can have those numbers um in normal range um without medication. Is everybody having this? Is anybody else? Oh, hearing loud and clear now. Okay. All right, great. Glad to hear you. Right. So diabetes reversal. And I believe that once we implement those all the once we create a holistic approach, once we have a holistic approach to diabetes management, yes, it can be reversed. What cannot be reversed, however, is the complications of diabetes. So if you already have kidney problems, if you already have circulation problems, heart problems, as complications of diabetes, that cannot be reversed. All right. So that is why it's crucial that um as soon as you are diagnosed with diabetes to make that have good management. All right. Now, Dorothy, you that question says that you're missing what I am saying here in this presentation. All right. Diabetes management is not about only what you eat. It's a holistic approach It must involve everything. It cannot only be just diet. All right. So if you're gonna ask me about diet, um, and then by the way, as you touch on diet, there is no, there's nothing, there is no diet for people with diabetes. There is no diet. All right. There's nothing that is forbidden. There are some things that you want to avoid as much as possible. There's nothing, however, that is forbidden. All right. Um, and so when you're going to ask what the diet should look like, um, you know, it's saying that you think that just eating right is going to fix it. That will not, that is not it.
I, I would like to make a contribution here regarding the diet piece. One of the things that I would do for our diabetics is to ensure that the individual has sufficient fiber in their meals. So
Yes, yes.
yeah, so
Uh,
non-diabetics will eat bananas, and entire
yes,
bananas,
yes, yeah.
watermelon, they will eat grapes and all of those. However, in that same meal, we will need to have adequate fiber. So for example, a breakfast meal, say if we did apples and or banana, then I or two fruit, different types of fruit. Then I would come in with say brown rice or quinoa, and with peas or beans, at least a serving, which is at least a half cup of black beans, for example. And this is breakfast. So say we had bananas, then I have some quinoa and black beans, and to end the meal, a closed handful of nuts. And that would be a breakfast meal. Now, when you have the fiber coming in there, you're looking at the peas, the beans, the brown rice. You have, if it was another meal, say we did some lettuce and then cabbage, carrot stew with peas again, and the brown whole grain rice as opposed to refined items, then that glucose will rise, yes, but gradually, like an aircraft taking off, as opposed to getting the sugar spikes, which is what we want to avoid. So with a rising glucose level gradually, it helps the body to respond better. You don't get that high spike, which will demand a lot of insulin production, thereby creating inflation and with that lifestyle change. Yes, the foods we manage, but walking. So even after a meal, we have what you call your digestive stroll. You walk for 15 minutes afterward, and that will have you again to manage that glucose level. And so that 15-minute stroll puts a cap on that spiraling sugar increase, and causes it to more like taper off a bit. And there again, you get that less of that insulin spike in the system. So the walking, good sleep, early sleep, all of those, because the late night sleep tend to increase the cortisol levels and all the things that he's been mentioning. So everything sort of works all together, but let's do what, is like healthy, and that helps tremendously. In fact, right
Uh,
now, yeah, go ahead.
yeah, I, I, um, I would say, Natalie, that is ideal. But then, I believe in looking at what the person can afford, looking at what they like, because we're looking at something that has to be sustainable. And if they don't like a certain kind of food and we try to introduce it to them, they might follow it for a while, and you know it can affect the sustainability of that. And so it's about it's I would prefer to identify what they use and help them to understand how they can use what they're using, right? And that's why I'm glad when you start off with fiber, all right? Because um, while they may be, if they even if they are using refined foods, we can help them to understand the amount and help them to identify some fiber-rich food that can be combined with that food to help to create that same effect that you're talking about, where the increase in blood sugar is slow. You're muted. You're muted.
Yeah, thanks. Um, yeah, and what we call the glycemic load. So even if individuals did bread, but again, try and make some efforts to get more wholesome items, because it to
Yeah,
me it does indeed require a change. You can't be doing the same
right.
thing that you've been doing before, and now you're pre-diabetic. It's time for action. Don't wait to be fully diabetic. Unfortunately, some people wait till they have an amputation, and then now they're making the
Yeah,
same changes they
yeah,
could have done before and avoid themselves a situation. So that works. Um, and yeah, we have done where, look, do you like this? Do you like that? But help the person, to sort of carve out
that's
as to
right. That's
what.
right. That's right. Right. So we move them from where they are to where they need to be.
One of the
Yeah,
things that
yeah.
I'd remove is like sodas.
Well, well,
Where
even that might be a challenge. Even that might be a challenge. Um, but it 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 must be a gradual um process. It must be a process. The change must be a process if it's going to be sustainable.
yeah, if they have the time, if they have the time to do some gradual change, then
Yeah.
that's good. But don't stay in transition mode for too long, because this is something that is quite serious. It can take the life. I've seen where diabetes take people's lives. It takes their limbs, so it starts eating away at them little by little. So if you don't do make a change, and then speak to one of us to get that help and tailored program for you, because it
Yes, yes,
really put you in a
yes,
wilderness where, just like the person is asking, what can I do? What should I do? And,
yeah,
connecting with us would help you better.
yes. Yes, you need that support because it's not going to happen it's not going to happen just like that. You need support. You need somebody that's going to hold you accountable. All right, set a plan for you, right? I talk about it being a transition, but it must be a planned transition. So you must have a goal in mind as to when you're gonna get to where you should be. All right. And so that will require some support. And so as she said, you need to consult with persons who are able to work with you.
Very good. Well, thank you very much, Mr. Cooker, for the presentation today and enlightening us on this very much relevant topic in our society. Interestingly, today we began a session here at the Pure Wellness Lifestyle Center, and it is focusing on diabetes. So we do have quite an an audience of individuals, and over the next 11 days, they're going to be focusing predominantly on diabetes, its reversal, and what it takes to reverse that
That's
and to
right.
become diabetic. So it's not only the educational piece, but that they would be living it and
Yes,
learning how to prepare some healthy meals. So it's part
exactly.
of the lifestyle dietary change that we're talking about, so that when they go back home, they're pretty much comfortable as to what they can do to lead healthier lives. One of the things, as
Wonderful, wonderful.
you keep understating, is that um, or emphasizing rather, is that even though you're diabetic, there are other complications so that can happen. So you may end up having heart-related issues, brain-related issues, as we focused on today. And so it's not just that you're diabetic, but at the same time, it doesn't only come alone. So there are individuals who may have high blood pressure, but soon enough, they can become a diabetic because of
Yeah,
the same unhealthy foundational diet and lifestyle is what's feeding the body lots of inflammation and leading in disease in varied forms. So we only hear about a particular name condition, but what exactly is needed for a healthier body and state, that's where we need to go back to the root cause. All right, so if we have no further questions, our time is at hand. We do want to thank you all for being here. And let's see, do we have Tobago on the line? Next month, in the month of August, will be Tobago featuring. I'm not sure if they have a topic to, hold our interest between now and then. If
So,
not,
Dr. Nash, we have not Brother Simon here.
yes.
Hello? Hello?
Yes.
yes, we're
Yes,
hearing you.
we're hearing you loud
Okay,
and
yeah,
clear.
so I
Yes,
just
we're
want to again
hearing you.
thank Mr. Crocker so much for the presentation, because I think, honestly, from where I sit, I think we have been losing the battle over and over again in regards to diabetes, all
Yeah,
because we have been not using that holistic approach and not recognizing that there's a mental health aspect to it. They all interface and influence each other, and so I was really pleased and really happy with the presentation. It was well done. Information was really out there. And I think if we were to employ those strategies, we'll definitely win the battle. But we have been losing over again, sadly, because we only see it as being strictly medication and probably
yeah,
diet in some regards. So I'm really happy with the presentation, and I really, really appreciate it a whole lot. Regards to
right.
next month, we have not really settled on a topic yet, Dr. Nash. We'll get information to you by the end of the week that is coming, so we'll put it out there for you. Thank you so much again.
Okay. You're welcome. Thank you, Brother Simon. All right, so let us close with the word of prayer. Our Heavenly Father, we want to give you thanks for our discussion today. We thank you for our presenter and for leading him in this area where he's able to help so many in their moments of need, as well as to educate the public, including us. We pray for each person on the platform and even those with their health challenges, that you lead them in the direction in which you will be able to help them more, and that they would learn and put into practice healthier habits and lifestyle and diet. We ask that you continue to be with us between now and our next appointed time. This is our prayer in Jesus' name. Amen. Thank you, everyone, and do have a blessed week.
Thank you too. Thank you. God bless you.